Becky, I think we're hearing from Tanya. She may be running a little bit late. Is that correct?
Yeah, Tom, you are correct there, but we can go ahead and begin. We can kind of just skip over to your slides if that's all right with you.
That would be fine with me. Should we give just another minute for anybody else to join us? Or
we sure can.
Well, it is 12:01, and I know everybody's busy and trying to get this call in for lunch. So let me welcome everybody to our Division of Child Care and Early Childhood Education monthly call. It is great to have this opportunity to visit with all of you. Tanya is in another meeting, and she will be joining us in just a few moments. So I want to cover, oh, there she is right there, already joined us. So with that, I'll turn it over to our fearless leader, Ms. Tanya Williams.
Thanks, Tom. Sorry, gang, I'm late. I had another meeting that got pushed back and got backed up. I try to keep the space around this meeting open so I can be on time. And so I apologize today for being a few minutes late, but I know there are staff who'll be giving you additional updates, but just good afternoon. I hope everyone is safe.
Lost sound.
Across the state, and certainly even in childcare that we have seen. As of yesterday, we had 2 facilities that were temporarily closed. So that's kind of fluctuating. The highest it's been in the last 2 to 3 weeks is 5, but it's usually 2 to 3 every day. Our current capacity is 173,948. Yesterday, I received a report from the team that we have 12,588 essential workers. $1 million. That is a new federal requirement in the American Rescue Plan Act funding that we have to certify that. And also a check stub because we need to determine that they are not eligible for regular low-income child care, as that would be, oh, Kelly's letting me know my audio is going in and out. So I apologize to all of you for having to listen to that. Hopefully that it will get better. It may be the weather here, maybe our DHS system. Is that any better? I'm right at my computer. So if you are serving families, again, please make sure that they complete the certification form regarding assets equaling or exceeding $1 million and a check stub to make sure they are not eligible for regular low-income child care. Those are federal requirements with the American Rescue Plan Act funding and are really critical, and we can't approve them. So if you look at your families and they're expired as of the end of October, it's likely they did not return that, and you could help if you can just give them a little nudge. We'll get them redetermined if we can get those forms in. Otherwise, they're going to have to come in with a brand new application and get behind the 800 or 900 families that have filled out in the meantime. So then on the CURSA funding, which was pre-American Rescue Plan Act funding from last December, we have spent 105 of the 119 million. So we're just billing out the remaining essential workers. Some of you may not have billed through the end of October yet. And so we'll just keep that open for the next couple of weeks until we get all of that billed out. We're keeping a small amount for essential cleaning, and we will retain that. These funds are good through 23, so we'll continue to have that available for you. But I think that will take care of that funding as we work through the next couple of weeks and get the remaining building in for essential workers. And then Mom has some updates on American Rescue Plan Act. Just a reminder to please make sure the email on file with child care licensing is updated. If you have not checked that, I think we've heard from a lot of you, but if you're talking to, maybe you've gotten your application in, but maybe you've talked to a colleague or a friend that works in early childhood and they haven't gotten the link yet, it's most likely because the email on file is not updated. So please, please make sure that if you have not been able to access the application for operational funds in the new American Rescue Plan Act funding, we need to make sure you have an updated email on file. I'm going to stop there. I know, and I'll start manning the. I'll come back to answering questions after everybody else is presented.
I hope everybody can hear me now. I know we're having struggling. Can shake your head if you can hear me. Okay, thank you, Tanya. So a little updates on the Harper Stabilization Grant. I checked this morning. We still have right at 1,000 facilities that have yet to even start their applications for the operational payment grants. That's quite a few. We've had 736 that have got into the system and started their application. We have 421 who have started the application but have not yet submitted the grant for us to review. So that's well over half that have yet to even submit the grant and give us an opportunity to approve. Presently, we have 269 applications that are in the review process, and we have a total of 50 applications that have gone all the way through the review process. So we're calling folks as quickly as we can and speaking with those. If we needed any additional information for those review processes. We will be making payments from all approved applications on twice a month. We'll be doing that on the 5th of the month and on the 20th of the month. If that 5th or the 20th lands on a Friday or a holiday, it will be pushed to the next business day. For instance, the 5th falls on Friday. They will not make payments on Friday, so we'll submit those files for payments on Monday, on Monday of this next week for payment on everyone that we have approved. Right now, it looks like we have about $1.5 million approved. Hopefully by the end of the week, we'll be at least double, maybe triple that in approvals to go out this week. And then we'll be looking at that again on the 20th of the month to submit another file for payment for anyone who did not meet the 5th deadline approval for payments. So providers do need to go in and apply for these grants through the portals. If you are having any problems at all, you can contact your licensing specialist. You can contact Paige Cox or Nicole or myself or Rachel Machen. All those numbers, we're trying to make sure you have no wrong doors. I do know that several of our grants coordinators have been making calls, sending emails, trying to get folks to submit their grants. So if you have any questions at all, please get with us because we want to get these operational grants approved as quickly as possible. I've been asked several times when the quality improvement grants will go live. We're expecting those to go live the 1st of next week after we make our first operational payment grant. Our quality improvement grants will go live and you can begin applying for those. Finally, I know Tanya has mentioned it, but essential worker cases will be closed if we do not receive the requested redetermined paperwork. I've been telling folks that, you know, the eligibility requirements for the ARPA funding are different than they were for CRSA. And that's why we've had to request that information that Tanya talked about. So be speaking to your families and asking them if they've submitted everything that we need to get those approved. We certainly it's our goal to get those approved as quickly as possible so that you can make billing on those essential workers. And that's pretty much what I have at this time. So I'll turn that back to Becky.
Now I'm going to jump in here as we're transitioning to the next slides for Kayla Bodie. There are a couple of questions in the chat box. I think Brandy is answering a lot of those, but I just want to kind of go back through. If you have families that were essential workers, if they turned everything in and we received it, they should have been authorized starting November 1st. We did a system update that allowed the November and December authorization to occur, and then staff keyed the January through April. So if you're showing them starting in January, then those are the families that we have not received information on. It could be that they've submitted it. And I know, Brandy, there were people submitting it to the wrong place. So if you can let them know where they should submit that certification information and check stub information to, I think that would be helpful. But I'm seeing a lot of questions about that. So, and I saw one specifically about mine start on January 1. That's because you have families that did not turn in that information and we didn't key them or have them ready for approval for November and December. If we can get that certification of asset information and a check stub, we can get those keyed. But as Tom's letting you know, if we do not hear back, Tom, is there a timeline that you all will just stop keying those families that were in prior to today?
So we will start sending out closure notices today for those families who did not respond to the 10-day notice that we sent them. Actually, this is the second notice that they've got, Tanya, to respond. So we'll start closing. However, if they can get that information to us, even after the closure within 10 days, we will reopen that case without a new application. If we're waiting after that additional 10 days, then they will have to have a new application.
Good. The questions.
I'm sorry, Tanya, you broke up. I did not hear.
Sorry, I said I'm going to go ahead and let Brenda go to the next slide, which I think is Kayla Bodie, and then I'll go back to monitoring questions.
Afternoon, everyone. So we just have a couple updates from the background check unit here. And we're excited to let you all know that the form stack forms for the background check consents and the Arkansas maltreatment checks, both of those are back up and running. So you can continue to use those links online. And then we all want to invite you to join us for our next provider training. We will be doing a NICAR electronic background check training on December 30th from 12 to 1 p.m. And I will post a link to that in the chat box along with my contact information. So if you have any questions regarding background checks, you can reach out to me. And that's really all I have. I hope you all have a wonderful rest of your week.
And Kayla, I see a question about the training that you all are doing. The question is the check scheduled on the last Thursday of each month?
Yes, so the training is the last Thursday of every month. We are not going to have it in November. It does fall on Thanksgiving. So the next one will be in December, but it is the last Thursday of every month for childcare providers.
Thank you. Thanks, Kayla. Appreciate you all and everything you're doing. I'm going to go back up just because I know everyone cannot get on the call every single month. So just to sort of bring you up to date, if you've missed the last few calls, we are now in the American Rescue Plan Act funding portion of COVID relief funding. Those are brand new funds that we received notice of earlier this year. We were spending CURSA funding, and we're going to finish that out. We're about to finish out all of those funds, but we sent out notices to providers through the email account in your child care licensing system. Whatever you have listed, and you may have done it a long time ago. I can tell you I've talked to literally hundreds of providers who had dead emails because maybe they had hired a director who no longer works there, or maybe they've changed their email. So if you have not, you will receive the first opportunity to apply for fundings, which is different than we were doing last year. We won't be just processing payments anymore. There's a new requirement by the feds that we have to have a grant application process, and we're using their grant application. But you will get a link to apply. The first opportunity is operational, and it went live the first week of October. And so Tom was letting programs know we've had quite a number submit their applications. We have received applications. Payments will be processed on the 5th and 20th of the month after you have submitted your application. So if you've already submitted yours and it's approved, has all the completed information, there's no question about it, then Tom and team will start processing those the 5th or 20th. If there's a holiday, it will be the next business day after that holiday. So if you have not received the link, the email would have been from a no reply, which is also equally confusing to people. It's not from Tanya or Tom. It has a no reply in the subject line or in the to line, from line. So when you get it, and thank you, Rachel's put that in so that you can see what that looks like. So if you'll look up in the chat box, it's a no reply at notificationhelp.com. And that's what you will get as a provider to the email on file, get you to the link to apply. It is a simple online application process. The first wave of funding is called operational funds. And when you go into that link and start filling it out, it will tell you what you can use it for, and it will let you know it is populating the information from what is on file in child care licensing, your capacity, and then you put your enrollment in, which could be more or less than it probably will be less than your capacity. That's generally how that works. If you go over your capacity, you will get blocked. It won't let you do that. It's not allowable. So if there's something about your capacity that's wrong, then you need to contact your licensing person, who will then probably need to come out and measure to make sure that your capacity is right. So just know it's all connected to existing data. That is the first opportunity. The second one, Tom announced, will be coming out later this week, early next week sometime. It is called Quality Improvement. Again, there will be an application for the Quality Improvement grants that are through the American Rescue Plan Act funding. And so if you've already submitted your operational, then your next one will be quality improvement. And there are different amounts. Somebody's asked that question. They're not all the same. They're based on different things. The staff worked out a very carefully computed system for that to make sure that we use all of the funding and that every provider has the opportunity. In other words, this portion of it is not competitive. It is not competitive. Your program is going to get your funding. You do have to submit though. So if you need help, and I know Tom said a lot of programs haven't even started the application process. So we're going to be reaching out, and our child care aware colleagues will also be reaching out as we go forward to make sure that you have the link and that you have the opportunity. We want to make sure every licensed program, family child care home, has the opportunity to apply both for operational and quality improvement. Those are not competitive. We will later move to a capacity building and expansion. The expansion will be first for existing providers, and that will come out either in December or January, and will be an opportunity for programs that were licensed on or before March time startup cost type funding if you wanted to open up a classroom within your program. So I know the internet connection, I'm getting signals that it's unstable, so I apologize, gang, for the technology today. I know that we generally don't have too much trouble, but I'm so sorry that we are having a bad connection. I'm trying to make sure I've answered all the questions. You had to be licensed on or before March 11th of this year. That is a federal requirement. That is in the Federal American Rescue Plan Act law. So that's why we have that date. It's not a Tanya law or a Tom law. That is a federal requirement. I'm going to go back through and try to do some questions. So Tom, a question from Courtney Mabry, will the grant application say approved, or how do they know? I'm telling people
I'm trying to get in. Can you hear me now? So I'm not sure if it sends them a notice yet or not. We'll be looking into that. It should, but I'm not 100% positive.
So if it is approved, though, it will go to the bank account that's on file. And so start looking. If you've submitted and you haven't heard from us for any clarifying questions, it's possible that around the 5th of next week, you will have money in your account equal to what you applied for. We will work with our vendor to see if we can get some kind of feedback loop. Just know that we worked on this very quickly to get an online automated, so you did not have to submit paper applications. So, there are things like this that may not be in place yet, but if we can get that feature looped in, we will do that. I'm going to go to one from Elaine Mills. So Elaine, for your families that are essential workers, if they are starting on January of 22, it means that it's possible the parent either sent it to the wrong email address or something about their information has not gotten back to the staff. So I'm not saying they didn't submit it, because sometimes people have submitted to the wrong place. But what I am saying is we have not received it and cannot key it for November and December. And so we definitely want to do that. We don't want there to be a gap for you. So if you have any families, any of you on the call that have families that are not keyed for November and December, follow up with them and make sure that they are submitting it. I think Brandy has put in where they should send that information to, or who they should send that to. So I can't emphasize that enough, because we don't want to have them have to reapply. We would like to take care of those families that were already in and try to do it quickly. Brandy, do you want to come off mute and talk about that for a minute?
Yes, I do want to let you all know that we have not gotten to everyone just yet. So we still have several families who have submitted their information to the redetermination box. However, we have not gotten to them. When we get to someone and their application has been processed, they will be contacted via email. So they will receive a notice letting them know that their application has been processed or their redetermination has been processed, and you will be able to see those authorizations in your box. When you see an authorization that starts in January, that is happening, just as Tanya said, that redetermination has been processed. We were waiting for the system to process November and December. So all of you should, for every one of your current essential workers, you should see authorizations in your system right now for November and December. If you see January forward, that means that family has already been processed and they're good to go. That family has been contacted via email as well, letting them know that they are good. Now, as I said, you're going to see for all of your families, November and December. If you don't see anything past December, it likely means we have not gotten to that families yet, or that we have sent them a notice requesting additional information. We are requesting this via email for all of your families. So I would encourage you to ask them to check their email. They need to know the email address that they submitted on their application, because that is the email address that all of our notices, any correspondence is going to go back to. We have had families that have forgotten which email address that they submitted to us. So I would encourage you to ask them to make sure that they look at that. I did see a question in the chat about new families who had applied back in August when we switched our funding stream, or before we started processing again. All of those families, if they were on the waiting list, all of them have been contacted via email as well. They have been contacted requesting the attestation of assets, because we have to make sure that they declare that they don't have assets equal to or over $1 million, and their check stubs, because we have to verify that they are not eligible for our low income program. So if they have not submitted that information back to us at the end of their notices, then those cases will be denied or closed. So please encourage your families to check your email, because those are going out mass to everyone, and then we're processing the information as we get it back. Thank you, Tanya.
Thanks, Brandy. I know Rachel responded on stipulations to receiving this grant funding. Yes, this is federal money, and so there are stipulations. First of all, as I mentioned, you have to have been licensed prior to March 11th, on or before that date. Whatever you submit in your application is what you should use the money for. I feel silly saying this, but unfortunately we see things here that I know many of you would be shocked by, but you can't take a trip to an island on this funding. That would not be allowable. It has to be used for the operation of your program. And you'd be surprised at what we see here, gang. So you need to keep your receipts and invoices for any things that you purchased, both for your accounting purposes, if you are required to have an audit, but also for requirements on us where we may have to have a team come out and just verify. So yes, please note, this is $464 million given to our state, and it has to be used for the purposes that the federal government has said it's to be used for. Your program also needs to be open. We can't fund a program that isn't operational right now. So it has to be a program that is open and serving families. That wouldn't be fair to all the programs that have remained open and are staying open. So those are some of the stipulations. I know Rachel responded to some reporting requirements and audit requirements, but if you have questions about any other of the requirements, I mean, it's, whatever you put in your application that you want to use the funding for is what we would expect that you will use it for. So if you're going to buy HVAC or something to improve the quality of air at your center, or cleaning supplies, or you're wanting to do some playground upgrades, those things should be attached to a receipt that you have to document and show. So hopefully that helps for those of you that have questions about that. But every program that was licensed on or before March 11th is eligible. It is not competitive. Yes, Nikki, if I understand your question, all families who are eligible will be keyed through April 30th. We're being done in 2 phases. The January through April that have been keyed, and then the November through December was a system where we just basically had our IT vendor push a button. But we do have to have the information to verify their eligibility. In other words, they have to certify that their assets do not equal or exceed $1 million. And we have to have a check stub, because we cannot have any essential worker families that are eligible for regular low income childcare. And we have discovered some. That's not an issue for the previous funding, but it would be an issue for the current funding. That is a federal requirement. So great question, Jennifer, on the quality improvement grants. It is for the existing levels, since we don't have any. Whatever level you're assessed at currently. So if you're a level 3, you will get the, it's based on your level 3 status. We may need to connect Allison Griffin. Thank you for your question on federal or DHS audit requirements. The threshold, it's Tom, I may need you to type this in because I may get it wrong. I'm not the finance person. So we're not the finance people here. I know for DHS, if you get over 100,000 in funding from DHS, you are required to have an audit. There are some other requirements for for-profits, and I'm going to mess all that up. So my best advice to you is, call our audit department, and somebody can put in John Park or Kelton Phillips, and they can help kind of point you in the right direction. or you can talk to a local CPA firm. But if your organization receives over 100,000, there's some chance that you might be required to do that. I know for all nonprofits, that is the requirement, but I think for for-profits, there are some differing requirements. There are also some federal thresholds. So Tom, clean that up for me, please.
So any nonprofit that receives more than $100,000 are required to submit a DHS audit. There are different amounts for profit, but basically anybody that receives more than $350,000 in federal funding has some type of a federal audit that has to be posted. And then 750,000 has another level of audit. I've talked to our Office of Payment Integrity and Audit, and they have instructed us to tell folks to contact a CPA and get professional advice, because we are not the professionals, and that it would be not beneficial for us to provide audit advice since we are not audit professionals, but those are the limits. I did see the question, if I budget 5,000 for plumbing, a sink, and 2,000 for training, but didn't use it all. You can, in the operational budgets, move around up to, I think, 15% of your funds in any way that you need, as long as it's in an allowable cost. The real thing is, if you get chosen for an ARPA audit, they'll want to see receipts for the entire amount of ARPA funding. So if you received $25,000, the OPIA, which is our Office of Integrity and Audit, will expect to see $25,000 in receipts in categories that are allowable. So you do have some function in being able to move that money around to a little bit. If you're going to make major changes in your budgeting, then you need to contact us.
Thanks, Tom. I see a note from Lisa York that some families have been approved through March and others through the end of April for essential workers. I don't know why they should all be keyed through April 30th, as I understood it. So we may need to work with Lisa and determine what's going on there. If it's not essential worker families, they aren't keyed the same way. So Lisa, if you take other vouchers, maybe it's some families that are not essential, but I'm not questioning you on that. I'm assuming these are essential workers, and we will check into that. May need you to reach out to Brandy and team individually so that we can go in and look at your facility specifically and find out which families are keyed incorrectly. They should all be through April 30th. And please note Tom's advice about consulting with a CPA firm. We are not the CPA experts, so highly recommend that you talk to someone for your own purposes to get the best information for your program. So appreciate that, Tom. And the grant will not be deposited on the 5th. The payments, we don't process the payment. We don't write a check from here or send we have to send it over to the Department of Finance Administration, who then releases the funding. So whatever your bank account system is, they're all different. Banks have different processing dates. Again, not the finance expert, but I've spent a lot of time researching this with some of you to figure out where your payments are. And your banking processing time, it hinges on your bank timing. And so I don't have any control over that. I can tell you that Tom's team is committed to processing the payment to the Department of Finance Administration on the 5th and 20th of the month. If there's a holiday, then it will go to the next business day for state government, and it will be sent over to DFA. And then whatever your bank processing time is the time frame on your payment. So I don't want you to be thinking your payment is going to arrive on the 5th. I'm not expecting that to happen unless you have some really speedy banking system with DFA. So thanks, Jill. For those of you who serve Head Start and ABC families or have other funding sources for families, yes, if they are covered through ABC and do not need our services, it would be helpful if they could let us know. But if they are being served by ABC, or if you want to let us know any of the families individually working with our staff so that we can remove those and not be worried about dropping these families, that would be most helpful. But I know that I've talked to a few providers that have moved those families into another funding source. And so we won't know that without you communicating that with us, or unless they communicate that with us. So much appreciated if one of you, either the family or the program, can let us know any families that you have moved into a different funding source so that we can continue to serve other eligible families. So. Okay, I see a request from Tiffany Sharp on a step-by-step guide uploaded on the DHS website for the ARPA application process and dates of release for each grant. We will work with our comms folks, Tiffany. We've put out some things, but we don't have anything quite like that out there yet. So Tom, if you and Brandy can take a note, please know that our comms team is not assigned to just our division. It is assigned to the health agency. So we will work as quickly as we can, but I think that's a great suggestion, and they're very good and can help us hopefully with the visual that will help all of you in a step-by-step.
Tanya, there actually is a step-by-step guide
Oh, thank
on the
you.
website. It is, I'll put the link in there again. It's set up as a PowerPoint, and it provides all of the dates as well. So I will include the link again.
Awesome team. Thank you for that reminder. So Tiffany, we have that. We'll get that to you. If you can send it to Tiffany directly, also Paige, but get it posted in the link so folks will know how to grab that off and hopefully use it. So thank you guys. I should have known you were well ahead of me on that. And Ms. Turner, yes, families can still apply for essential worker. Let me just make this announcement. We are not granting any waivers for programs for essential worker families any longer. We are not in the same crisis that we were in last year. So your program must be eligible to receive vouchers. In other words, you need to start working on applying for level 2. That is the requirement. So we will not be granting any additional programs. The only way that is even a possibility is if we are in tiny town, Arkansas, and there is no other childcare available, we will take that into consideration. But we're just in a very different place, and we want to make sure that the programs that are going to serve our voucher families, all of them, including the low income families, are participating. And so we're going to route families to those programs that are eligible to take vouchers as we go forward. So I just want to make sure everybody knows that. Happy to talk individually with you, but I think we've got sufficient programs open. We have 2 programs closed today. So we're just not in the same place. And so it's causing a lot of work here on my team to have to review those every week. And it's just a small group of providers. When we look at them, most of the time it's in a community that has other voucher participating programs. So we're just going to try to route families to those programs. Just want to make sure everybody knows that. The funding is for, okay. The essential worker information is for funding for childcare, Ms. Boyland. The funding for the operational is really for your center or your program to use for your program. It's really not for childcare tuition. I'm not sure, Tom, if you have any comment. I don't know if there's anything that prohibits you if you want that, but right now, while we have low income childcare tuition available and there's no waiting list, and essential worker childcare available, I'm not sure why anybody would want to use their operational for childcare tuition, but and I don't know if there's any reason it's prohibited from being used for that, Tom, but comment there?
There's no prohibition from using that, but that would be a decision that they would need to make and say why they're using it. But I would agree with you, Tanya, there's really so many other opportunities for funding that I wouldn't use it for tradition, but that is a choice they can make.
Thanks, Tom. And I think on the application and probably on the step-by-step that Paige has put into the link, you will see what acceptable uses for each category of the grant funding. I believe that's in the PowerPoint and available for you all to be able to use that.
And if they find a category that doesn't fit any place, there is an other with an explanation box of what they're going to use that funding for.
Yeah, I encourage all of you, I know there's some questions about how much. I would encourage you to go in and do your application. That's where you will determine. Everybody's amounts could be different based on your capacity and your program. So that's how you will find out what you're eligible for. There is information in that step-by-step, and that will help you calculate so that you can see about how much money your program would be eligible for. So there are limits to that. And again, we did it in a way to calculate all of the providers in Arkansas that were eligible receiving the funding. That's how the calculations were done. Tom, can you put the amount that we would pay for an audit? Is there an upward amount? You can use your operational funding for audit, and we encourage you if you need to include that. That is an area of acceptable. But is there any upward amount or min max on that?
There's not an upward amount or a max because every program's audit is going to be different on the amount of funds that they're looking at, the number of families that they're serving. So we did not put a maximum amount. I guess the maximum amount would be the total grant amount if they felt like an audit cost that much. But I would encourage them to get bids from CPAs on what an audit would cost and look at it at that cost, at that amount.
Yeah, I see several questions about the audit, and I think people are trying to respond to it. So I thank all of the staff for being on top of this. You really need to consult with a CPA firm in your community, not our DHS folks. They may have a list if you don't know how to contact someone in your community, but we are not audit experts or financial experts in our division. And our CPA and audit folks have advised us to encourage programs to reach out to the auditors in their community. So you can just look on your phone, Google CPA firms in your area. If you live in a small town, you may have to go to a larger area around you, but I just would encourage you to talk to someone. The threshold, as Tom put out there, is 100,000, but they're based on the complicatedness. So the more funding you receive, the different types of funding sources can drive the cost of an audit up, the size of your program. All of those things are what is calculated into that cost, but we are not experts and we wouldn't know how much money it would cost you. And I certainly wouldn't want to give you advice on which CPA firm. I'm not going to endorse any, but our team, John Park and Kelton Phillips, work in our Office of Payment Integrity and Audit. And I know that Kelton oftentimes has a list of auditors from around the state that do state audits, because they are kind of government audits are a little bit different than your normal reviews that you're accounting that you might be doing for your home. So you certainly can reach out to them. And if somebody can put Kelton's information in the chat box, they're not necessarily going to tell you who to use though. I just want to make sure we're all clear about that. They can tell you some list or give you some advisement of a list of people within a community or where you might be able to go to find that information. But thank you. And Rachel's put Kelton's info in there. I'm just trying to go through, gang, and see if there's anything else. Brenda, do we have anything else on the slides?
Yeah, you guys, I just kind of wanted to just share real briefly about the COVID call center that we have over at the Department of Health. We just wanted to remind you that they are closed on all the state holidays. So if you do have something related to COVID that pops up at your facility, don't call on that holiday, just call on that next business day, and they will be there to help support you and answer any questions that you have got regarding that.
Thanks, Becky. And I know, just a reminder, there is a state holiday, I believe, next week in the middle of the week, maybe on Thursday, Veterans Day.
You are correct, November 11th.
Okay, thank you. That's a hard one to keep up with. So November 11th is a state holiday. And so the call center will be closed that day. So Sandra Withers, thank you for, as always, for reminding us about the vaccine and that this pandemic is not over. And we will continue to watch, because those states that have colder weather are starting to see the numbers go back up because people are moving indoors, and the spread is highly infectious. And so we're starting to see in those states that are up in the northern part of the country where cold weather is already set in, a surge again. So just hope everyone is getting the vaccine. I know here at DHS, we have flu shots and booster shots on Friday, and I'm signed up for or volunteering myself for my booster. I've already gotten my flu shot for the year. I hope many of you have. I took a 4-year-old to get his too. So we're all about the vaccines at my house. If he could get a COVID shot, I'd be taking him for that today too, just to keep everyone safe. But thanks, Sandra, for always reminding us of how important it is to take care of one another and our own health. There's a question about, Courtney, that's a great question. The last quarterly payment, I think as we've transitioned and talked about the ARPA funding, and because we added so many essential worker families, I'm not sure there will be any more maintenance payments. We've talked about that on the last couple of calls, that we would be flipping to the application for ARPA funding, and that those things would coincide. If there is funding left, you know, we may look at a quarterly payment, but right now it is too early to say. All of the billing for essential workers is not in. We still have programs billing through the October 31st timeline, and I'm not comfortable saying we have enough money to make a final payment. But if we get to, you know, after 60 days from October 31st, when everybody's had a chance to bill, and we can say there's adequate funding, we will definitely do a payment that would be in between your applications, or that's a possibility. But if there's not enough, then we can't do that. So that's kind of been the discussion. We did make a final supplemental payment. I believe that's been processed, Brandy, Tom. I know it went over, I think, last week to DFA. So you should have seen the last supplemental payment. So that last, before the new rates went into effect, we did it for the full month of September, not just the partial month, which we had originally planned to do. We did it for the full month. So that also took up more funding. So we're just playing it really close to the vest this time, because we are just about out of the curse of funding. And I feel like you all can submit applications through American Rescue because it's open now, and you'll have a lot of opportunity to do that. So, see Tom putting information out there. I don't see anything else in the chat. I would encourage you, if you don't know which families have sent in something, you might just put a quick note up tonight, or put it in backpacks tonight, or in bags tonight, or on your door. Just if you have not heard on your essential worker, and you can look in the system, as I understand it, Brandy, they can look in the system and see if their families are keyed for the month of November and December. So if you see that you have families not keyed, then it's very likely those are your families that haven't submitted that documentation yet. So, but but as Brandy pointed out, there are some families the staff are still keying. So, you know, we're not asking you to panic yet with us, but we just want you to know if they haven't submitted, that we're going to have to close those out and move forward. Okay, I do see a few questions. Well, that's a great question, Kathleen Hell. I would not encourage. I will tell you, this is one-time funding. So just be aware, anything that you use it for is only one time, and it could go away. So anything that you do, you know, would be for whatever period of time the funding is available, but there's certainly nothing, you know, I can't say you can't do that. I think it would be an allowable cost for the expansion, but just note that if you don't have a way to fund that beyond that time frame, then that, you know, is something that you'd want to consider as a program. So, Brandy, there's a question from Casey about the timeline for a family who received an approval letter until they're able to see them on the childcare billing. If they received an approval letter, they should be keyed, right?
Correct. And the provider will see that in their system before the approval letter even goes out, because it's going to come through our overnight batch. So you'll be able to see the approval in your system immediately.
Okay, I see a question. The deadline to apply for quality improvement, when that one is released, we are not putting timelines on these. We want, you know, our timeline will be in conjunction with the federal time frame, and there is federal time frames for these funds to be utilized. So we have to monitor that closely, but we're trying to allow programs, you know, as much time as you need to apply. So there isn't a time frame for the quality improvement. These funds are available through 2023. I think for us, we have to have those completely liquidated by September 30th of 23. So we'll have to monitor, make sure that all programs have applied prior to that. So we'll be looking, you know, as we go into 22, if some programs haven't even submitted an operations grant, then we're going to have to do a lot of outreach to help those programs and make sure either they are or they're not. There are programs who may say, I don't want to apply, and that's perfectly acceptable. Then we will put out a second wave for programs that may want to apply. So there's an opportunity. This money, we want to use every bit of this money. We don't want to send back money to the federal government if we don't have to. So we want to use it all. But we want to give every program the opportunity first, and then we'll put it back in either the quality improvement and then just keep pushing that. But we do have a timeline of September 30, 23 for all of it to be used in the stabilization portion, which is what we're doing right now. So the other money, the supplemental, the essential worker money, and the teach scholarships we have through September 30th of 2024. So there's a little bit of a longer timeline, although I will tell you all, I don't see the essential workers going through that time frame. I see that money getting used way before that. So we will keep you posted on this call. And we will know as we get closer into the spring and near the end of April, probably in March, if we keep adding families, as to how long we'll be able to keep families out beyond April 30th. And the quality improvement is not out yet. So no, thank you, Rachel. Rachel's trying to keep everybody apprised of things. It is not live yet, only the operational, but it will be released, you know, I think Tom said as early as next week, possibly. And I see a question, the licensing intent empowerment training. I'm not sure if somebody from licensing, Lisa Bush, or somebody maybe from licensing that wants to talk to that, if you don't mind coming off mute. I'm going to take a stab at it.
Yeah, Tanya, I see that Mary is trying to speak, but we can't hear her. Maybe I think she's working on a microphone thing real quick.
Okay. Yeah. Let me just tell you what I know. She can't talk. Okay. What I know about it is if you're a new program, I would highly encourage you to take licensing intent training. I mean, you should be doing that anyway, but if a program is having a lot of issues with licensing, we might have that as part of the corrective action. So that happens. I'm not sure that it's required if you're an existing program and you're not having problems. But if you're new and or if you are on a corrective action, those could be. I see Lisa shaking her head. So I think I have it fairly close to right there. But that's really, you know, for programs that are new and or who may be having problems with compliance issues, Ms. Boylan. So certainly if you want to, or if you have a lot of new staff, that would be another reason that you might consider, you know, if you want your staff to go through. But unless you've been required to by the licensing staff, you don't have to for an existing program, unless you're under a corrective action. I see a question. If you apply now, I'm assuming for the operational funds, would it be possible to receive them after the first of the year? I'm kind of going on a hunch that you're trying to keep the funding into a new year and not on this calendar year. So this is, you know, yes, okay. I would say I would wait, because we're not going to know to hold those funds, and Tom's team is going to be reviewing and approving those as they come through. So, you know, these are not competitive, and your opportunity will exist beyond December 31st. You might want to send somebody, you can let us know, send it to your licensing person that you're waiting. I guess what I would say to you all is I spend a lot of time here on the phone with providers who are crying about money, who are saying, I need money. I don't have enough money to do the things that I need to do. And so, I can't run your operation and your business, but when I see somebody pushing it back, you're going to get the funding. So if you want to postpone it for a few months, it's going to be there. We can't go past 23, as I mentioned. So at some point we'll have to cut it off, but right now you can. So I don't see any problem with that, but thank you for asking. It's a great question. And I know we've heard from some programs that are worried about the amount and how it's going to affect their funding for the year. So very much appreciate that question. But I also want to be mindful of all of you who have called me in tears about resources this past year. So just don't mean to be fussy about that, but I've heard that a lot. So just want to remind folks of that too. So just, if you want to wait until January, don't wait forever. do it as soon as you can, but January is fine. Nikki Barker Turner is asking about the email for essential worker families. Brandy, I think you put that in there, but that's a great question, Nikki. I think it's the essential worker family, but I know they've changed it. Maybe EW something now. So Brandy's going to slip it in there for us. Okay. Thank you, Brandy. Appreciate that. All right, gang. Well, it is almost the top of the hour. I always want to say thank you to all of you who are working so hard and tirelessly and have for the past year and a half, almost 2 years now we've been at this. We're excited about the funding opportunities for you and just look forward to seeing some amazing things happen as we go into the remainder of this year and into the new year with more opportunities for funds. I am going to be on a call. If anybody is paying attention to the national news, I am going to do a national call this afternoon regarding the Build Back Better. If you're not paying attention to that, there is a ton of information related to pre-K, universal pre-K for all 3 and 4-year-olds, and childcare quality, and for families earning up to $300,000, as I understand it currently. I am going to be on a national call. I will have some updates next month if I get adequate information for you all. I don't want to put out information that is not going to be helpful, but I also want you all to be aware. And I encourage you all to go out and Google and look at that. It is working its way through Congress. It may or may not pass. It may not pass in the form that it's currently in. It could be less than. They could take out the child care. I don't know any of the details yet, but I am going to hop on a national call today to start getting additional information about that, and we'll try to give an update next month. And I did see a question about there's no deadline for the quality improvement grants other than the September 30th of 23 timeframe for the state to utilize the funds. And so that means we've got to push back our timeframe to an earlier time frame to make sure we get it moved out. So, just encourage you to apply either through the end of this year or early in February of 22. But we don't have a timeline on that. And that, I think, concludes. Thank you all again, and we will see you next month. So I see okay, Brenda's putting up the next call, December 7th. I did see a question, and I just want to address that, Susan. Great question. So no family child care if licensed for 16 would be eligible for the 3rd grant. Well, not necessarily true if you wanted to add on or if you wanted to get a bigger facility. I mean, I see where you're coming from, and that's a great question. If you have no space to expand, then yes, this is really about expansion. They really want states to have capacity growth, and we know that we may need that in some areas of the state that have no infant care in particular. and school age care. So that's a great question that I would encourage you to look within your community and see. Maybe I have seen some family child care homes move to centers and have a slightly bigger program. So, or maybe use some additional space. So I don't want family child care homes to think they are not eligible for expansion, because I do believe some will apply for expansion. So the next call is, Jennifer Easley saying that December 7th is on a Wednesday. Did we get the wrong day, gang? Oh, I'm seeing Tuesday. Jennifer, check the date again. Hang on. I'm checking it myself. I'm seeing nodding heads there. I want to make sure before we leave you guys, we've given you the correct information. I'm showing December 7th is on a Tuesday. So December 7th is on a Tuesday. Okay, good. She's working a year ahead. All right. Thanks, Jennifer. And thanks all of you. Be safe. Take care of yourselves. And we'll see you in December.